Well, days before her death, it was announced that Barbara Bush had decided to focus on comfort care in lieu of further medical treatment. Today, Nancy McKiernan, Director of Marketing and Development at Baptist Health System, is here to answer some questions about what comfort care is and when it should be considered. Nancy, welcome.
Thank you.
Thank you for being here. So I'll just kind of get right into it. What does it mean to be on comfort care?
Well, comfort care is also known as palliative care, and it's an essential part of medical care. Sometimes people might think that it means stopping all medical treatment and then it only is given at the end of life. In reality, comfort care doesn't mean denying medical help, but the focus is more on managing the patient's symptoms and keeping them comfortable and letting them retain their dignity. And it can be provided at any stage of an illness. For example, when Barbara Bush had COPD and congestive heart failure, in her case, comfort care might have meant drugs for pain management, diuretics to remove the excess fluid from her lungs, oxygen to help her breathe better. So the focus is more on comfort than life-saving measures at that point. And comfort care isn't meant to hasten death, but rather to allow the illness to run its natural course and provide ease anxiety at the end of life.
When are some other times that it's typically administered?
When are some other times? It can be where it can be in a hospital, in a nursing home, in the patient's own home. At some point, family might decide on a hospice that's devoted exclusively to providing comfort care.
And how do patients and really families know when it's time
that's the
to
important
think
question.
about this?
Yeah, sometimes people wait too long. There are some questions that people can ask themselves. What's the nature and the course of the illness? Some illnesses, like certain cancers, have a natural progression. That makes it much easier to anticipate when comfort care might be needed. What options are available for treatment? Has the person already exhausted all their treatment options, or would further treatment maybe increase the patient's suffering or decrease the quality of life? What does the patient want? The answer might be determined by how old they are, what stage of life that they're in, the amount of pain or discomfort that they're in, and how they want to spend their time. You know, some people opt for comfort care simply because they want to spend that time at home with their family instead of in the hospital.
All right, Nancy, a lot to consider. Thank you so much for your time. Of course, if you want more information, all you have to do is check out Baptist Health Nursing and Rehabilitation Center. Their website is on the screen. You can also give them a call, 370-4700.